Millions of people are now eligible for the COVID Pfizer booster shot, but there's a lot of confusion about who can get the vaccine and when. I spoke with the chief medical officer of Blue Cross Blue Shield of Michigan earlier today to get some answers for you.
Okay, so I think what a lot of people want to know right now is who can get their booster.
Michelle, people over 65 are eligible to get the booster. As far as the others, like between 18 and 64, those that are at high risk for severe COVID, people with cancer, chronic kidney disease, hypertension, diabetes, Down syndrome, coronary disease, or heart issues. The other group that we're looking at that's between 16 and 64 is those that are at high risk for getting severe COVID because of the nature of their jobs. They're around a lot of COVID potentially.
Mm-hmm. So we're talking about first responders, and are teachers eligible?
That's actually up to interpretation. You could actually say teachers are, it's at risk for their jobs because they're with a lot of unvaccinated kids all day. You ask me my personal opinion, a teacher should be eligible.
Yeah. And a lot of places are offering these boosters right now.
Yeah, so you'll find the boosters everywhere. So remember the first round, especially when we had a shortage of a vaccine, they were mostly county health departments and health systems. You'll see them at your national drugstore chains. You'll see them at your local drugstores. You'll see them at Meijer. You'll see them at all sorts of places now. So it's not as restricted as it was round one.
Yes. People also want to know exactly when, how many months. There was some confusion about how many months after you got that second dose that you should get your third.
Yeah. So Michelle, what they're saying now is that it needs to really be at least 6 months. So if you think of it now, we're in October. So 6 months from October would be April. And that's really when so many people got it, was between that initial December release date and April. So really almost everyone's eligible for it now, assuming you had it before April.
And do we have to remember if we got Moderna or Pfizer or the Johnson & Johnson shot? Is that important?
Yeah, it's important because what you need to do is you need to bring in your vaccination card, and they need to know if you got Pfizer, you're going to get Pfizer. And that's what they're doing right now.
Okay. All right, good. Anything else that people should know?
One thing I want to sort of, if we've got this opportunity, the one message I want to leave is if you're going for your booster, don't forget to get your flu shot.
Yes.
The flu still exists. And, we didn't have a lot of flu last year because everyone had masks and social distancing, but we're relaxing a lot of that now. That you can get, a COVID booster in one arm and a flu shot in the other, and they're perfectly fine to give to both. The only message I want to leave everyone with is get vaccinated. That's the only way we're going to get through this. That's how we got through so many polio, rubella, things like that. We got through that by vaccinating everybody. That's the one message I want to leave. Vaccinate, vaccinate, vaccinate. My loved ones get it. I'm just making that recommendation to you too.
Great advice. Great to see you. Thanks so much.